Good afternoon, everybody. Today is May 27th, 2022. My name's Scott McGann with the Falmouth Health Department. If you'd like to email us, it's health@falmouthma.gov, and our phone number is 495-7485. So let's jump into it. 4,710 PCR positive tests since the beginning, which is 72 for the week. Last 2 weeks we were over 100, so we've had a better week, not great, but still, that shouldn't say May 19th. That's actually should have said May 26th. It's May 26th. 16 probable cases in the past week, which are the rapid tests, but not home tests. So home tests are not showing up, in this, and that's one of the problems with this, and I'll talk about that in a second, about giving you case counts. So Falmouth's 14-day incidence rate has dropped a little bit from 48.5 from 48.1 to 46.7. Again, it's going to pick up those 2 weeks over 100 are captured in this. So I think next week, if it's 72, with the 72 number, that'll definitely probably go down. If it continues to go down and trends downward like it has the last couple of weeks, this number will start to fall. But our positivity was 9.46, which is down from 10.15, so down 1.5%. Still very high. So all the numbers are still high, but at least trending better. As you can see, this is our second week or so where the case counts have gone down, much similar to all the other times that we have increases in cases. It's definitely like a wave, a hill, and a crest. So hopefully this starts to moderate downward, and then we have a decent summer. So that's the hope. But getting back to the tests, remember, since January we have home tests, roughly around January of this year. And these case counts are just what they are. They're just PCR. They're not counting home tests. The state's even considering not posting a daily case count because, again, what's the relevance if we're only capturing PCR? We're not capturing them all like we used to. And so you may start seeing the state stop doing that. They've been talked about that yesterday. And it's the same with we'll probably do the same because it's not really relevant. I think the multiplier could be as much as, it could be somewhere around 3 times as many cases than we actually get. It might even be more, but somewhere around maybe 2.5–3.5% could be more. Our actual case counts when you start factoring in those home kits. Again, home kits are not counted on here, so these are just PCR. But at least it tells you relative to other weeks how we're doing. It just doesn't necessarily tell you how you're doing with an actual accurate case count. Again, trending. We're still on the trending up to slightly down. I hadn't fixed this slide, but the circle would be close and it's slightly lower. So I'm flattening out, hopefully, with the case counts. We're still high for the county. The case counts dropped from 340 down to 270 per 100,000 daily case rate for 7 days. The admissions are a little bit high. I think it was 14 and change last week. It's 15 and change now for new admissions per 100,000 population. So that's how many people have gone to the hospital, admitted and have COVID, 15.5 per 100,000. So that would be somewhere around 34 cases, 34 hospitalizations between the two hospitals over admissions. And then inpatient beds staffed with COVID-19 is still not bad. It's a little bit higher, but 4.7% of all beds are being are patients with confirmed COVID. So that's the ones that are staying. And these two numbers going up and this one going down doesn't surprise because there's a lagging indicator. So this is capturing more of last week or previously the higher numbers. So the case counts will drop. These will go up, still continue to go up. When they drop, when the case counts go up, this also lags. This is what we call a lagging indicator. So we are still considered high, as is most of the counties in Massachusetts. As far as what to do, considering mask wearing indoors, especially if you're high risk for severe disease, considering masks. The state is not going to implement, at least in the foreseeable future, any mandates. We have only an advisory in town hall buildings, but we don't have any mandates. There's no mandates that I can find pretty much anywhere. Healthcare still has it, but not for the general public and in general public buildings. As far as hospitalizations, these are starting to look like they're flattening a little bit. The daily beds used flattening, and then this one's pretty accurate relative. This is a pretty good number. How many people are going to the hospital relative to previous outbreaks? See, the highest we had is when the original Omicron, with the sheer number of cases that we had in January, and then the January of 21 as well. You can see that those are our two biggest peaks. This one is probably, up there, in one of our higher times that weren't counting the 2 Januaries. You can look at it here and see that the green line, represents from day 1 all the way over. So we're sort of similar to where we were, let's say, the fall of 21, somewhere in there, maybe. The hospital admissions are up, but then if you look at ICU beds and number of beds, the people that are actually staying there in the hospital for COVID, you see that number to be more in that, it's a little higher than, let's say, the fall of 2021. Again, confirmed cases, again, not capturing home tests. It was 5,000 something last week, around 5,000, and it's 3,400, so a little bit better. As far as the trends, you can see them sort of, the deaths have gone up a little bit, but it's a relatively flat relative to the case counts. You see that peak, and then you see a little bit of a drop, and then you see the hospitalizations sort of maybe leveling out, and you see a little bit down on the positivity. I think there's a trend in these directions for a bit now as we get into the summer. Usually, if you look at our previous previous cases, the summers have generally been better than the winters for obvious reasons. Colds and flus are always that way. MWRA numbers is pretty cool. You can see that there's a downward trend MWRA in the far right. This is just measuring the wastewater in the Boston's system, sewage treatment system. And then you see a downward trend. You can see it a little bit better here. This is a narrower trend. This is this year, and this is the southern section of it. They have a northern and a southern. They break it down, but they're both similar. And you can see a downward trend, somewhat of a downward trend in terms of MWRA, looking at what the viral RNA, for the for COVID, and you can see that there's a downward trend similar to us. We're starting to see the last week or two, that we're a little bit better than we were. Our incidence rate, again, like I said, 46.7 is sort of everybody's sort of high, or most places are high except for the Outer Cape, and we sort of fall in the middle. And gives us a dark color, and hopefully this will continue. This is also a little bit late on the data because it goes from the 8th to the 21st, so more last week's numbers are incorporated, and so hopefully that number should go down after having a slightly better week this week, roughly 30% better. Our positivity is sort of falling in that sort of same range. Eastham and Orleans and Yarmouth had the highest. Rest were falling in the 8 to 10 range, with the Outer Cape doing better, with at least with PCR. I don't know if they're set up a lot with PCR. They might use a lot more rapid. Not quite sure. Again, for this chart is my chart I show every week. This is fully vaccinated individuals. That's numbers are relatively stable every week. 1.6% hospitalization among people that got COVID that were breakthrough, and a death rate of half of 1%. So your likelihood of getting hospitalized from COVID if you've been vaccinated is relatively low. And 10% of all people have had breakthrough cases that have been vaccinated. It's 10.5%. And of everybody who's been vaccinated, 0.17% have been hospitalized. That will count people that have not gotten COVID that are vaccinated. I like to use the number of the 1.6 because if you get COVID, obviously if you don't get COVID, you're not going to the hospital. But if you get COVID, the hospitalization rate is 1.6%. Booster doses are here. It's been since March. 50 and older can get a second booster at least 4 months after their first. And 12 and older and 18 and older can also, depending on their comorbidities, do the same thing. And you can definitely mix and match between the RNA vaccines, so Pfizer and Moderna. Vaccines, VaxFinder, there was over 100 spots when I looked over the next 7 days at the local pharmacies. So go on VaxFinder to find one. Homebound should be calling that health department number at 495-7485. If you get to your summer home, you notice your neighbor who's not doing well, is elderly, and has not been out or able to get vaxxed, definitely you can call. Give us the information, or that person can call. We'll schedule that with the VNA. Again, plenty of open spots. Testing, home tests are going to be the primary. The hospital is still open, and Convenient MD and the pharmacies still also do some testing. Convenient MD probably the most, and so you still have the ability. The county is not doing any more testing right now, so it'd be more in the private sector. So the Convenient MD, the pharmacies, and the hospital. Vaccinations, we gained about 159 doses through the week, with most of them being boosters. Some people got vaxxed for the first time, which is great. Some people got their second dose, and like I said, about 86 people got a booster. There's plenty more capacity to do more than that, even in Falmouth alone. So if you're thinking about it, this would be, as good a time as any. As far as what the variants are, again, you see that steady increase of the BA.2.12, sort of, consistently pushing out the original BA.2, and the original Omicron in purple is sort of fading away. And this is normal. This just seems to cycle through every few months. So you don't see anything new. We don't have a new color coming in that says that the BA.2.12 is going to be supplanted at some point. We don't see that right now. It's still mainly the BA.2 and the 12. So again, as a review, and a better week than last week. The last couple of weeks, you start seeing it maybe a little bit better. The county, most of the states, still high. There's plenty of vaccine. Second booster doses, plenty of availability. There are no mandates per se, and so each individual needs to consider their circumstances and mask as they see appropriate. You can wear his mask as frequently as you'd like. And I don't have any indication from the state that we would go in a route of mandates at this point in time. So that's what I have for an update, and we'll do this again next Friday, and everybody have a good long weekend. Thanks.